This is Dr. Ruben Chen, and welcome to the Vital Signs Podcast. Hi, this is Dr. Ruben Chen. Welcome to another Vital Signs Podcast. We are very happy. We have a great guest lined up. But before we get started, I want to do a shout out to our Sunriders that are listening to us. For those of you who don't know what Sunrider is the world's largest privately owned food manufacturer with herbal health foods ranging from herbal toothpaste to skincare to protein powders. They are awesome. So if you are new to Sunrider, come and check us out at sunrider.com, or you can talk with your local independent business owner. And for those of you who are longtime Sunriders, please come and continue to share this podcast with your friends and help them learn a little bit more about the Sunrider lifestyle. So today we have a very special guest, Dr. Sara, and she has a lot of great experience. And I'm going to first let Dr. Sara introduce herself and a little bit about what her background is. So can you tell us a little bit about yourself?
Sure, absolutely. And thank you for having me. My name is Dr. Sara Poldmae, and I am a licensed acupuncturist, a doctor of acupuncture and Chinese medicine, a Chinese herbalist, and I'm also a functional medicine practitioner. So I have been in practice for about 18 years now. Before that, I was actually a massage therapist when I worked my way through both undergrad and grad school. And I own 2 wellness clinics in Annapolis, Maryland. I have quite a few acupuncturists working for me, and we each have kind of our specialties, but acupuncture and Chinese medicine always treat the whole person. General health is super important to us. So specialty is a bit of a misnomer. We all have areas that we focus on more in practice. But we love seeing all different types of people, but especially the people that walk through the door really wanting to take care of themselves.
So you mentioned something interesting. So what is functional medicine? Because that's a little bit different than just acupuncture.
Right, absolutely. So functional medicine, actually, I think that Chinese herbal medicine was kind of the first form of functional medicine, in that it was really looking at the whole person and the imbalances in a person in order to figure out not only how to make a person more comfortable and get rid of symptoms, but also how to treat the whole person to make them a stronger individual as a whole. Functional medicine, from a more Western perspective, looks at blood work and looks at a general health status, and then tries to figure out, similar to Chinese medicine, what a person's constitutional makeup is and how we can potentially prevent and help disease instead of just putting a Band-Aid on it.
Oh, so you mentioned blood work. So what are the things that you are looking for? Somebody comes in, they want to do a functional medicine and Chinese medicine workup. What are some of the things that you're looking for?
Right. So we can look for a lot of things, but the expanded blood work, for instance, if we were doing a blood chemistry analysis, we would actually look at ferritin levels, which a lot of MDs for some reason go past. And when we see people with chronic fatigue, we try and make sure that we're looking at more expanded blood work in order to make sure we're not missing anything. I myself focus more on the Chinese medicine aspect of functional medicine. And if I feel expanded blood work is necessary, I actually refer out. I prefer to try and work more with lifestyle techniques and making sure there's proper diet and proper herbal supplementation to make sure the person's doing everything that they can for themselves, unless, of course, I see a red flag of some sort.
Yeah. So how did you get into Chinese medicine? I'm sure, I guess in like massage, there's a lot of that sort of overlap, but how did that, because it's not, maybe you should also explain what is the length of time to become a licensed acupuncturist, because I think a lot of people would be surprised.
Right. I know I've sat at dinner parties before and have had people, their jaws drop because they think maybe it's a 2 or 3 week training.
Like some
Well,
weekend course that you can get.
right, right. So I was actually living in Washington, D.C. at the time. And after undergrad, I earned my massage certificate just as a way to have an income while I worked through grad school.
Mhm.
When I went to grad school for Chinese medicine, was out in San Diego. So in California, the scope of practice is quite large. And out there, it's a solid 4-year program after undergrad. So it is a professional master's degree. I went on to get a doctorate as well a little bit later on. But usually, if you're seeing an acupuncturist, they'll have schooling of at least 3 years post-grad, if not 4. And then if they are a doctor of Chinese medicine like myself, that's looking at between 4 and 5.5 years of school post-grad. So,
Wow. So
mhm.
what are the focuses that make it unique, say compared to a Western medical doctor? If somebody is coming to see a licensed acupuncturist, what do you think that they should be expecting?
Right. So we really look at the connection between all of the different body systems as well as your mind. So the mind body connection is really important. So if we see someone that's fatigued, but they're not getting any exercise whatsoever,
Mhm.
and they're also slightly depressed, we're not simply going to go for let's fix the fatigue. We're going to look at trying to boost their mood, try to get them moving again. So we look at the whole person as much as possible. Of course, we're going to treat the symptoms. So we have symptoms, and then we have the constitution. We call it the root and the branch. We go for the symptoms, we make the person more comfortable, but we have a dialogue between the practitioner and the patient to make sure that we're addressing the person as a whole if we're really doing our job.
Yeah, that I feel like especially the last couple of years, people have recognized that need in their life. I think maybe I know that I'm a Western medical doctor, but there is a very reductionist thought process. What I would say is a lot of Western medical doctors look for quantitative life. So, like making you live longer, but there's an aspect of medicine, what I think of as like a qualitative life, making the quality of your life better.
Right.
And I think that I feel like everybody encountered a lot of that during these last couple of years. But during these last couple,
Absolutely.
yeah, I mean, what are the things that you've been seeing the last few years that have been maybe more frequent or more common now that people are coming out of lockdown and trying to get back into society?
I think people are acknowledging their mental health a little bit more.
Yeah.
Not accepting that anxiety and stress and depression and just not feeling well from a mental health perspective, not accepting that that's acceptable.
Mm,
So we're seeing a lot of people being a little bit more proactive in taking responsibility and holding themselves accountable for how they choose to spend each and every day. There are a lot of, as you said, in Western medicine, it's about how can we get you to live longer. And I personally would rather have a great 80 years on this earth than a substandard 95 years on this earth.
right.
Mark Hyman said something along the lines of, I want to help people to live as long as they can, but a good life, like not an existence. So
Right.
I think people are starting to just see that. I've had so many patients do things like quit their jobs because the commute was killing them. So once the employers asked them to come back to work, they wouldn't.
Hmm.
They decided that the sacrifices weren't worth it. So, and that's across the board. I'm sure everybody's seeing that with their friends and family as well. But I think that people are just starting to ask more of the right questions, and some of the comorbidities that were involved with COVID were lifestyle related diseases. So,
Hmm.
if you have metabolic syndrome, if you're 60 pounds overweight, you are much less likely to get through COVID in a mild manner. You're much more likely to be
Yeah.
hospitalized. So I think when people were starting to see that, it's not just about what does that 60 pounds mean? And this is not a fat shaming discussion at all, but,
No,
60 pounds of belly fat is not good for a
I mean, that
long,
wears
healthy
on your
life.
joints. It wears on
Mhm.
the organs inside your body.
Absolutely.
I, I would challenge somebody to walk around with a 60-pound weight vest for a week and see how they feel. And they'll
I
feel
did it with
different.
40 pounds with my daughter, and it
Right.
wasn't super comfortable when she
Right.
was in my belly.
I know women
So
experience this all the time. I talked with my wife about it, and she said that it's amazing. Pregnancy makes you feel young, and then 80 years old, and then young again. Like this, like
exactly.
very concentrated time.
Right, right.
So,
So we're seeing a lot of that. We're seeing, and having been in practice now for almost 2 decades, I am seeing a lot more people in the past 2 years coming in more for the maintenance that we preach for my entire clinical career, but really taking it seriously. And people that I would not have guessed would take maintenance, general wellness, health quite as seriously are coming in and saying, yeah, I definitely need to make sure that I'm paying attention to body, mind, spirit, all of that kind of stuff.
I know. Unfortunately, I've been on the front lines of some unfortunate turns that people have had. I had a couple of patients of mine that gained, I think, about 100 pounds uh, due to alcohol and ended up dying of liver disease
Oh my goodness.
during this time because they didn't have anything to do. But then I had a few of my patients, one of them was quite obese, and he heard that COVID affects obese people. And so he made it a goal to start walking. And he had chronic pain and difficulties even just getting out the door. But I think a few months ago, I talked with him and he said, well, I've gotten up to about, he walks, I think he tries to get out and walk about 3 to 4 miles a day. So, and
Fantastic.
yeah, I mean, yeah, applause to him. That's so hard.
Huge.
So I really like your combination of mental health along with physical health. And I know that this is an aspect of Chinese medicine that's sort of unique
Yeah.
because it directly correlates people's, even their personality types with their physical well-being. How
Mhm.
do you address mental health, or how would you approach it?
So acupuncture is an energetic medicine. And sometimes the way I like to describe it is sometimes when people are anxious or depressed, they're in this vicious loop with themselves. They know that they should be doing certain things like going for a walk or, taking time to meditate or spending time with family, but they just can't get out of the cycle that they're in.
Mm,
So acupuncture can often be a catalyst for change. So just a few acupuncture treatments can really flip a switch. As an energetic medicine, it's like a spark plug almost, and get
mhm.
these changes to happen. So that's anxious, we can just kind of take their nervous system down a couple notches so that they can say, oh, wait, I feel better when my nervous system's down a couple notches. Or someone that's
Right.
depressed, we might be able to just elevate their mood just enough so they start doing things like going for a walk. I mean, that's one of the best things in the world for depression is just a simple 10-15 minute walk. So,
Mhm.
getting endorphins running in your system, acupuncture can do that, but you're not going to see an acupuncturist every single day. So we help them to create the changes that they can have every day without a visit to us.
Yeah. So what is a plan that you would give to somebody um, after an acupuncture treatment, or maybe somebody who can't come in as frequently? What is a typical, like, a self-care plan to help them improve themselves?
Yeah, so that can be different. Like you had talked about with different personalities affecting physicality.
Mhm,
When we look at the whole person and we make a Chinese medical diagnosis, self care will often be different depending on which, we don't call them archetypes, but I think that's the
mhm,
closest word to it, which patterns they fit into. So
mhm,
someone that is what we would call the water element. A kidney deficient person may need more alone time. So making sure that she
Mm,
honors that, and not trying to keep up with a really busy social schedule, which will deplete their energy. But making sure that they also don't become too isolated. So self-care can mean different things based on their Chinese medical diagnosis. Massages, pedicures, manicures, those are all great, but they're not true self-care in a long lasting sense for
right.
certain types. Now, someone with liver chi stagnation that's stressed out and all over the place, a massage once a week might be the perfect type of therapy.
Right.
So it really does depend which category they fall in. And often we are layers, like a peeling back an onion. We all have layers and we are different categories of Chinese medicine. So we usually will tailor the self-care when we send an email to a patient, a new patient, or we don't just send out a blanket, this is what everybody should do. That's,
Hmm.
we more will say, this is what you should do based on what you need. That will help you to either preserve your energy or move your chi. So it'll be tailored.
Yeah, I think that that is really valuable. I know that people often fall into the trap where they get advice from somebody that something works well for them, and therefore they think, well, this will work well for everybody. And obviously that's not the case. If
No.
somebody wants to really improve on their self-care, they've seen people like maybe different doctors, but it's just not where they want to be. What are some ways that you would advise somebody to help educate themselves? Maybe they're more water elements, maybe they're yin or yang deficient or something like that. How would you help somebody like that?
Well, seeing a Chinese medicine practitioner would be ideal, or maybe a naturopathic physician or someone that understands the connections that we're talking about, to help them to start asking the right questions of themselves. Because
Mm,
oftentimes we just jump to whatever seems to be the simplest solution, whether it's what your friend suggested worked for them, or sounds like a great idea, I'll go get a pedicure, that will make me feel better in the moment.
right,
But if you
self-care.
actually sit with yourself and meditate, and clear your mind and ask yourself, what do I really need? Those answers will often come to you if you slow down and take away the outside interference.
I
Um,
love that. So, what are some common misconceptions? And I'm sure that you've got probably a bucket load, but when somebody comes to see you, what do you think are the most common things that you're like, well, we don't exactly do that, or our approach is like this? I mean, what are the most common ones that you see?
So usually people are concerned about the needles hurting, and that's a misconception. Usually,
Right.
I mean, it depends on your acupuncturist, their skill levels and their empathy levels, but most of the time, acupuncture is largely a painless procedure, at least it should be. Uh, and then I think a lot of patients, maybe not as much now because acupuncture has gone more mainstream, but I think a lot of patients would walk in expecting to see, crystals and um, all sorts of woo-woo stuff, but we're a pretty clinical environment these days. At least we are. I can't speak for every acupuncture office out there. Uh, People think that it doesn't work, and that's not true.
Hmm.
If someone comes in with a condition that I don't necessarily have an idea of the clinical outcome, I will certainly let them know that, because there are certain things that I've seen that I'm like, I have no idea. One thing we've been
Right.
seeing a lot in clinic lately is chronic hives, either from COVID
Hives.
itself. Yeah,
Oh,
either from COVID itself or potentially from the COVID shots. I would say equal 50-50 between what we're seeing and
yeah,
the
I've been hearing quite a bit of obviously people coming out with some more side effects or long COVID issues, side effects
Oh, we
from the
see a ton more
vaccine.
long COVID issues than we see
Right.
vaccine side effects. Absolutely.
Yeah.
So we have been able to, if they don't, I think it's Xolair, maybe the chronic hives medication.
Mm,
Um, it might be a biologic, I don't know. Anyway, about 75% of people from the allergists I spoke to do respond to that medication pretty well.
Oh.
But we've had a lot of chronic hive patients in, and we can clear the hives up really quickly.
Hmm.
Had someone come in for chronic hives before COVID, I may not have known that because it's just not something we would see as acupuncturists in clinic that often.
Oh.
So COVID actually, has changed certain things. We're seeing a lot more of things like that, or just general fatigue and malaise, long COVID, loss of taste and smell. It's something that we've
Hmm.
seen occasionally in clinic, and now we see it all the time. So it's
Right.
actually changed our experience level with treating certain things, which is kind of neat. So yeah.
Wow. And I like that you mentioned that acupuncture is a well-studied system. And I would, when people ask me about acupuncture, I like to let them know that there has been more research into how acupuncture functions than almost any medication that we use today. Any medication. I mean, there are papers going back to the 70s all the way until recently trying to study the mechanism of acupuncture. And there's lots of studies about the function of it. But people are very willing to pop in like an oxycodone and cross their fingers and hope that their pain gets better or something like that. So
Right. And the thing with studies with acupuncture is usually there's no mention at the end of the study, like this is totally safe.
right.
There's a
Oh,
safety and
that's true.
efficacy section, but that's kind of glazed over. It's more like, what are the results? And my end game would be to have at the end say, what's the worst that can happen? Even if 36% of the patients get better, no one's going to die from trying this. No one's going to
Right.
get addicted to acupuncture and have all sorts of other lifelong problems because they've,
Right.
treated their pain in a way that's super risky. So the nice thing about acupuncture, there's a couple of nice things about acupuncture. One is that it is one of the safest medicines you can try.
Right.
Um, and then second, if I can't help a person with their initial complaint, I'm usually going to make their lives better in some way, shape, or form. So that's the
Hmm.
beauty of it. Is we can really, I believe wholeheartedly that I can help anybody that walks through the door. Can I help them with their chief complaint? I don't know until I know what that chief complaint is, but I believe that I can improve the quality of life for almost anybody if they give me a chance.
Hmm. And one of the things that I also noticed is that you started from ground zero, and now you are also successful in having quite a few acupuncturists under your belt, and another clinic. And you also do some entrepreneurship exercises for new acupuncturists, people who are trying to start out their own practice. What are some of the pitfalls that you notice that new people maybe starting a practice out or starting their own new business? What do you see that they usually fall into?
Yeah. So healers as a whole tend to not like to ask for money for their services. And I
Yes.
could fall into that category too,
Right.
but I acknowledged that about myself. And one of the first things that I did to invest in my business was to invest in staff so that I don't have to have that conversation with my patients directly, because it's a super uncomfortable conversation for a
Mm-hmm.
lot of people to have. You know, money is a big one. It causes breakups in marriages, it causes weird relationships no matter what. So I like to distance myself. So I always encourage my coaching clients that if they can, to hire as soon as they can, to handle
Mm,
administrative stuff so that we can stay in our lane. I think in business we have to acknowledge our strengths, and we didn't go to school to be sitting at a cash register collecting payments, scheduling appointments. We can use our skills that we've learned in school, and we can focus on being a doctor rather than all the other stuff, which I'm terrible at paperwork, so it's better some just doing that anyway.
I definitely agree with that.
Yeah,
Yeah,
for sure.
I actually was participating in um, a medical practice. I don't know, it's a business profile or something where there was a business expert trying to help with several uh, medical doctors and other chiropractors and such together on how to sell themselves. And I could see a lot of a lot of, just like you said, the healers, they're just like, never
Glaze
done
over.
that. Right. How to close the deal, how to negotiate. And I could tell, they just are thinking, I just want to help people. I don't know what you're talking about. It felt almost dirty. I can tell in their faces, like, oh, I don't know if this is the right thing I should be doing.
Right.
How do you help somebody through that? Because there is definitely that tendency. I'm here to help my friend or this client, and I want them to trust me. I don't want them to think I'm trying to milk money out of them.
So a couple of things. I actually use Western medicine as an example. When a doctor writes a prescription, let's say for
Mhm.
an antibiotic, and says you need to take this twice a day for 10 days, a patient doesn't walk out with their prescription and take the antibiotic once every other day for 4 days. Like, they follow the treatment plan. So I
Mhm.
coach even my other acupuncturists, but also my coaching clients, in that, remember why you got into the medicine, remember that you love the medicine, and then remember how you would want to be told to treat whatever condition you're coming in for. So it's not a selling thing, it's thinking of the patient's best interest. So if you recommend less care to a patient than they actually need, that's not fair. The patient invested their time to come to our office, so we want to
Mm.
make sure that we are setting them up for success.
Right.
So that's a big one. And I think that analogy with Western medicine, you just have to take the sales out of it and just tell the person what you truly believe is going to serve them. And then under promise and over deliver is a huge one as well. So they came in for acupuncture, but then help them in other ways, like make lifestyle suggestions that they can do, help give them ideas of reframing some of their negative belief systems about things. Oh, I'll never get well. Well, that's not true. You don't know that. Like,
That's right.
just because you haven't gotten well yet doesn't, the past does not equal the future. So that's one of the big things. And just knowing that you're not selling snake oil. If you cannot help someone, make sure you tell them that, because then you'll feel
Right.
better helping the next person that you know you can help. So it's not easy, but a lot of times it's just, usually if people can read some books around those thoughts, they can get over that hump. It's
Mhm.
just an
Yeah,
insecurity.
I like that, the prescription model, because
Mhm.
I some I've paid cash for a number of medical procedures, and it never felt uncomfortable. Usually the
Right.
practitioners were very frank, and they gave me, hey, these are options for you. I'm not going to pressure you into one or another. I think that this one is probably going to be the best for your situation, but you can see these other options as well. So that, and letting people feel like you're there to help them, and you're obviously doing your best. So what are some, and I probably, a lot of people are trying to get into this field of trying to help people, because I mean there's so many people that need help nowadays. What are
Yeah.
some suggestions that you have for somebody as they're starting out their own business? They want to help people, they're a healer, they want to be able to reach out and benefit people.
For sure. Well, if they've already done a training of some sort, or they have a current business, I would say get a coach or a mentor. I think that that's really important. I have always had a coach or a mentor. When I don't, I definitely can become stagnant and just do whatever's easy and in front of me. But when
Mhm.
I'm in times of growth, I usually either have a mastermind that I'm a part of, or have a mentor or a coach. I think it's just really important in order to elevate yourself. And that goes for, all areas of life. Like, you don't want to hang out with people that bring you down. So you have to choose your friends wisely. And same with business. You have to choose the people that you get advice from wisely too. Because you can listen to people that aren't in a great state with their business and professional life. You definitely don't want to listen to them. You want to listen
Mhm.
to the people that are killing it, right?
Right. So what do you think that a coach or a mentor, what do they bring that's unique? Because a lot of people will just say, well, I'm just going to read books, watch YouTube videos, or something like that. But what is unique about like a mentor or somebody there to talk to you?
So I think one of the biggest things is that we all have our blind spots, and a good coach
Mm,
or a mentor can point those out and help you to improve in the areas that you're weak, because we don't really like to confront those areas. I mean, I definitely will
mhm.
hide in my office sometimes when there's stuff going
Right.
on. So I think
Don't
that a
let me
good
know. I'm doing
right.
my
I
best.
don't
Right.
um, so I think a good coach or a mentor will bring those things to the table in a non-confrontational way, and will help you to maybe see which resources you do need, because we can read books, but if they're not the right books, they're not
Right.
going to be of much help.
Hmm. Yeah. And then obviously this goes without saying, but being open to that criticism as well.
Yes,
I've
I actually just spent a few weeks ago, I spent some time looking at emails from a coach of mine from 2012. And I would
mhm,
look at some of the emails I sent him and say, oh, good Lord, like, what was I thinking? I was definitely shut off, but he must have gotten to me somehow, because I can tell you that 2012 was the year for me. So it just was,
mm,
by him pointing things out, even if I could see in the emails that I wasn't receptive to it, things definitely hit home. Even if I wasn't ready to fully embrace it, I must have embraced it somewhat.
mhm. And how do you think somebody should go about finding a mentor or a coach? Because I mean, I'll bet 90% of most people in business will say yes, but I don't know if this is the right person for me, or maybe they don't understand my situation. I mean, how do you think it's the best way, or do you think just finding somebody is important?
Well, I think both. I think if you
Mhm.
can't do what I did personally, the first coach that I had that was really helpful was a recommendation from someone that I admired both personally and professionally. So if you can get personal recommendations, that's probably the best way to go. Just make sure that you're paying attention to who's doing the recommending. Like, you don't
Yeah,
want someone not thriving. You want someone that's
that's right.
thriving that you look up to recommend coaches.
Yeah,
And once you meet with them, you have to make sure that they're the coach for you, because they might have been great for your friend, but asking the right questions about what you think you need and that kind of thing. The Small Business Association definitely has some great programs for entrepreneurs. They never really worked for me, but have been supremely successful for certain people that I know in business. I tend to not, the people that are coaches for the Small Business Association tend to be older, and I just never could vibe with them. But it didn't, I'm not an ageist or anything, but it just felt like a large gap when I was in my 30s. Maybe now that I'm approaching 50, I could probably start hanging out with those folks and it wouldn't even feel like an age gap. But I've also taken part in some masterminds and opportunities that were indirect spinoffs from the SBA, which did help to keep me a little bit more structured. So that's something that I lack sometimes.
I love mastermind events. I think
Mhm.
getting in a room with maybe not people in the exact field that you're in, but people who are also entrepreneurs,
Yeah.
hearing their ideas, some of the struggles and strengths that they have, and seeing how that can adapt to your current business situation. I mean, it's always great. And I love hearing people who have a lot of experience to maybe just starting out couple of years into owning their own business. You learn from everybody for sure.
Yeah, absolutely. And sometimes, again, the advice that you get, you do have to vet it. When I
Hmm.
first thought, oh, I'll go to acupuncture school, I remember my mother, who I love dearly, she is my rock, said, oh, don't do that. Go be a radiology technician. And I have no idea where that came from. It was not at all interesting to me, but I know I'm a fiery type of person. I know if it's not interesting, I'm not going to succeed. Like, I am not someone that could sit at a desk all day long and do something that I just sort of thought was interesting. It needed to light my fire. So her advice was very well intentioned. She wanted safety and security for me, but I'm not that
Hmm.
safety and security person. So
Right.
although I love her dearly, could not take that advice. And I'm so thankful I didn't, but I can
Hmm.
still be very thankful for her intentions behind it. So you have to just, again, make sure you're getting advice from people, looking at it and saying, is this the right advice for me? Yeah, so I think, again, just making sure that the advice is right for you. And, when you're seeing a practitioner, the same thing goes. When you're a patient, you have to make sure that the practitioner is someone that you believe has your best interests at heart. And that could be a radiologist, but
Hmm.
you really want to look at your body as a whole too.
Yeah, I like that. I am a big proponent of getting a second opinion if you don't think the person you saw out was what you were expecting. And
Absolutely.
yeah, and who knows? Maybe the second opinion will just corroborate, yeah, that person was right,
Right.
but sometimes they may give you a different perspective that you didn't know. Never be
And
locked
you might have
down.
more choices that you didn't know you had.
Right. And sometimes I'll get a third or a fourth opinion too. I'm a sort of a picky guy.
Yeah, right. But most importantly, if you decide to go with that person and they tell you to take 10 days of antibiotics twice a day,
Right.
that's what you do.
Hmm. Yeah. Well,
You have to
yeah,
kind
it
of
just
go with it. You gotta,
sort of depends on what it is, obviously.
right, right.
So,
So,
how do people follow you on social media or get to know what you're doing?
great. So, I have two Instagram pages. One is for my actual clinic, which is at Meadow Hill Wellness. And
Hmm.
then I have Dr. Sara Poldmae, which I'm not sure if there's show notes that go along with this, but if there are, we can put at Dr. Sara Poldmae.
Uh,
They're more than welcome to reach out to me. I'm happy to give you an email to have them reach
yeah.
out to me if they'd like to directly. I love to talk to people. So I don't do a ton of the coaching anymore. I have usually about 5 or 6 word of mouth clients that I work with at a time, and I really enjoy the work. But since launching the second clinic, I've been spending more time in my brick and mortar.
Wow. Yeah. Well, I
Yeah,
mean, as everybody knows, being an entrepreneur is a 24/7 job. That's why I think that I don't know, they are the backbone. They are the backbone of the entire country.
yeah,
Entrepreneurs are, and they do amazing things, and they put their blood, sweat, and tears in everything that they do, and it's a tough job. So
yeah. It can be, but it's also a lot of fun and creates a lot
yeah,
of freedom and flexibility and all
I
that.
know it's almost like your other child as well. I mean, it's an amazing thing too to see your business flourish and to be able to know that you're helping people.
Yeah,
So,
absolutely.
all right. Well, Dr. Sarah, thank you for your time sharing about self-care and also about entrepreneurship, which is, I think those are two areas I feel, especially nowadays, people are very interested in. So,
Yeah.
um, so please
Thank you
follow
for
her
having
on.
me.
Yeah, thank you. And yeah, please follow her on Instagram. And for those of you who want to follow more about Vital Signs, you can check us out. Our podcasts are on Spotify and iTunes and wherever you can find um, podcasts. And we are also available on YouTube on the Sunrider International YouTube page. You can follow us on Facebook and Instagram as well. All right. Well, thank you for your time.
Thank you.
All right. Thanks. Bye. This is Dr. Ruben Chen, and I'll see you next time.